RMT union has today rejected another pay offer. So those strikes will be going ahead. And as we speak, if it's going according to the timings, our Health Secretary will be meeting with the Nurses Union all about the goings on there. But apparently he doesn't want to get into the pay conversation. So I'm pondering tonight, Peter, I'll start with you. There's been a lot of criticism levelled at this government saying that they are not involved enough with the unions in terms of these negotiations. Do you think they should be more involved or not?
Yes, I think they should be, because it's essentially reached a crisis point. And, you know, if Steve Barclay, the Health Secretary, is in negotiations tonight, then why has he left it to the last minute? And if, as your intro said, he's refusing to talk about pay, then why is he ducking one of the core issues? And I don't want to make everything party political because it's boring, but the perception might be that he knows something must be done, so turning up at talks at the 11th hour gives the impression of activity without necessarily engaging on substance. Yeah,
but when it comes to negotiations, though, most of the things do happen at the 11th hour. That is literally when a lot of deals are done. They're not done weeks and months in advance. It's right up until the bone in some cases, isn't it?
It's certainly right up to the bone, and I think that reflects both sides, really, as well as this kind of relatively slow wheels mandated by law of trade union ballots and so on. But there's no reason why Steve Barclay couldn't have got involved in negotiations before today.
Do you think he should have done, Henry?
Well, the government has actually already been getting involved in some of the negotiations. For example, with the railway strike, it's actually a very complicated situation because the unions are negotiating with the TOCs, the train companies, but then the government is intervening and setting conditions. But ultimately, yes, the government, as the ultimate employer of public servants and as the institution that distributes taxpayers' money, which is what pays them, the government does have final say over all of these decisions. And so ultimately, the government will have to be involved. So it's a bit surprising that they've been sort of hiding behind some of the sort of intermediate employers for so long, given that they are the ones who ultimately have to make the decisions.
But don't you think it's probably a case of actually they're sitting there and thinking if anyone can just sit there at a whim and summon, for example, Rishi Sunak, in some cases that's what they've been requesting, to come and meet and talk with them, then where do you go from there? If that is literally your first response, you want to meet the Prime Minister? Oh, yeah, OK, there you go, there's the Prime Minister. How do you move on?
I don't think anyone's saying that you need to send Rishi Sunak, but health ministers, not even the Secretary of State for Health ministers, negotiating with public sector unions and the NHS is probably just a reasonable part of their remit. Certainly, they should maybe have, if we'd had these, not necessarily these negotiations, but if we'd had a more regular dialogue sooner, maybe ministers would have seen this coming. And even if they weren't going to fold on the pay demands, they might have been able to have more time to get plans in place than they've actually had. So actually, it's simply a fact that, not really in the private sector anymore since Margaret Thatcher and all the trade changes she made to trade unions, but in the public sector, where you do still have these big unions capable of coordinated action, talking to the unions is part of ministers' job.